The United States Congress passed legislation last year that has significantly affected the long-term financial outlook of both Medicare and Social Security. According to the nonpartisan Congressional Budget Office, these changes have shifted the projected solvency timelines of the trust funds. If no corrective actions are taken, current law points toward notable adjustments in benefits in the coming years. This situation deserves careful attention because Medicare and Social Security play a central role in the retirement security of millions of Americans. Let us examine what actually occurred and what the latest projections indicate. In July 2025, Congress enacted the One Big Beautiful Bill Act. This legislation included tax cuts along with a new deduction for Americans aged 65 and older on their Social Security income. On the surface, this provision offers tax relief to many seniors in the near term, which can help reduce their annual tax burden. However, the law also reduced the amount of revenue entering the trust funds that finance Medicare and Social Security. A portion of the funding for these programs comes from income taxes paid on Social Security benefits. By lowering those taxes, the inflow of money into the trust funds decreased noticeably. The Congressional Budget Office released its updated projections in April 2026. These figures show that the Medicare Hospital Insurance Trust Fund, which pays for inpatient hospital care, skilled nursing facility stays, hospice care, and certain home health services, is now expected to be exhausted by 2040. This represents a reduction of approximately 12 years compared to the projection issued in March 2025. It is important to understand what happens when a trust fund reaches exhaustion. Federal law does not permit Medicare to borrow money or operate with a deficit in its hospital insurance program. Once the fund runs out, payments must be limited to the revenue collected at that time. According to the CBO, this would initially result in an approximately 8% reduction in Medicare hospital payments starting in 2040, with the percentage increasing slightly in subsequent years. These reductions would directly affect critical services. Medicare Part A covers inpatient hospital stays, emergency surgeries, recovery care in skilled nursing facilities after serious illness or injury, and hospice care for those with terminal conditions. These are not elective services, they are essential healthcare benefits that seniors often need most during the most difficult periods of their lives. An 8% cut may appear modest on paper, but when applied to high-cost hospital and post-acute care, it can have a meaningful impact on access and quality of care for many beneficiaries. A separate timeline applies to Social Security. The Congressional Budget Office currently projects that the Old Age and Survivors Insurance Trust Fund will be depleted by 2032, which is roughly 6 years from today. When the fund reaches zero, current law requires an automatic across-the-board reduction in benefits for all retirees. Nonpartisan estimates from organizations such as the Committee for a Responsible Federal Budget suggest this reduction could be around 24%. To put this into practical terms, for a typical couple retiring around 2032 or shortly thereafter, the annual reduction in benefits could amount to approximately $18,400. For an individual senior currently receiving about $2,000 per month in Social Security, a 24% cut would reduce their monthly payment by roughly $480. This is a significant change for many households. It could affect essential expenses such as utility bills, housing costs, transportation, groceries, and medical co-payments. These are not abstract figures. They represent real dollars that directly influence daily living standards in retirement. Two major pieces of legislation have contributed to accelerating these timelines. The One Big Beautiful Bill Act is estimated to reduce revenue to the trust funds by about $169 billion over the next 10 years. Additionally, the Social Security Fairness Act, which was passed earlier in 2025 on a bipartisan basis, expanded benefits for certain government workers and is projected to add roughly $200 billion to the long-term shortfall over the same period. Taken together, these laws have moved the insolvency dates forward and increased the size of the eventual benefit adjustments under current law. It is essential to clarify how these mechanisms function. The scheduled reductions are not future political decisions that Congress will debate in 2032. They are automatic triggers written into existing statute. When the trust fund balance hits zero, the Social Security Administration is legally required to limit monthly benefit payments to the revenue it receives in that month. No new vote is needed for the cuts to take effect. Congress would need to pass new legislation to prevent or modify them. The last time lawmakers successfully reformed Social Security to restore solvency was in 1983, more than 4 decades ago. While these projections are sobering, they are not inevitable. Congress has several policy tools available to address the situation. These include gradually increasing the payroll tax rate, raising or removing the cap on taxable wages, currently set at $184,500 in 2026, transferring general revenue from the federal budget into the trust funds, adjusting the benefit formula for future retirees, or implementing a combination of these approaches. Each option carries political and economic considerations, but historical precedent shows that bipartisan action is possible when the need is clear. For individuals and families, it is useful to consider what these projections mean for personal retirement planning. If you are already receiving Social Security benefits, your monthly payments are not changing at present. The trust fund still holds reserves and is projected to deliver full scheduled benefits through at least 2031, assuming no changes in law. However, being informed about the long-term outlook allows for more thoughtful planning. Those between the ages of 55 and 65 who have not yet claimed Social Security may want to factor these projections into their decision. Delaying the start of benefits increases the monthly amount you receive. While a higher benefit also means a larger absolute dollar reduction in the event of a percentage-based cut, many people find that the increased base benefit still provides greater overall financial security, especially when combined with other sources of retirement income such as pensions, savings, or part-time work. For younger workers in their 40s, 50s, and early 60s, these timelines highlight the value of building additional retirement savings beyond Social Security. Relying too heavily on current benefit formulas without accounting for possible adjustments could create challenges later. Organizations like the Committee for a Responsible Federal Budget have noted that the individuals most impacted by delayed action may be today's workers who are actively planning their retirements around benefit levels that current law may not fully sustain without legislative changes. Beyond personal planning, public engagement also matters. Citizens can make their voices heard by contacting their elected representatives. Whether you are a current beneficiary, a future retiree, or simply concerned about the sustainability of these vital programs, you can reach out to your member of Congress and your senators. You can express your awareness of the projected 2032 timeline for Social Security and the shifting Medicare outlook, and encourage them to work toward responsible, long-term solutions that protect the financial security of retirees while maintaining fairness for future generations. The Capitol switchboard number is 202-224-3121. When you call, the operator can connect you directly to the office of your representative or senators by name or by your state. In summary, the legislation passed in 2025 has meaningfully altered the financial trajectories of both Medicare and Social Security. The 12-year shift in Medicare's hospital trust fund solvency and the projected 24% Social Security benefit reduction in 2032 under current law reflect clear arithmetic realities rather than partisan debates. Addressing these challenges will require thoughtful legislative action. In the meantime, staying informed and engaging with policymakers can help shape outcomes that support the millions of Americans who depend on these programs. If you found this explanation helpful and want more clear, fact-based discussions about retirement planning, Medicare, Social Security, and related policy issues, please subscribe to the Golden Seniors Hub channel and like this video. Your support helps us continue creating straightforward, unbiased content that helps seniors and their families make better informed decisions.